Women can have heart attacks even as early as their 30s. That's a major risk factor. So here are some red flags to look for. Thank you for joining us on another episode of SAC Health Answers. This is our video program where we answer your questions about health to give you the knowledge to make decisions that will improve your health and wellness. My name is Dr. Jason Lohr. I'm the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today we have a question from Monica. And Monica asks, can an adult woman of any age have a heart attack? My medical history includes an aunt who had a heart attack when she was in her 50s. What should I look out for? That's a great question. And the short answer is yes. There is a dangerous myth out there that females do not get heart attacks and that they're somehow protected from heart disease, which isn't true. In fact, women can have heart attacks even as early as their 30s, 40s, or 50s. So this is a great question that you're asking. So let's break down your risk and, most importantly, the signs that are often missed. You mentioned that your aunt had a heart attack in her 50s. Well, in the medical world, we would actually call that a premature event. Premature because that actually happened before age 65. So if you have a first-degree relative, a mother, an aunt, a child that actually had a heart attack under age 65, that's a major risk factor. And so you need to be, for sure, looking out for potential signs and symptoms that you may have. What you should be doing is connecting with your doctor. At the minimum, you should have your doctor check for a cholesterol panel or a lipid panel, see where your cholesterol is, and check your blood pressure, because both cholesterol and blood pressure are both also, if they're elevated, increased risk factors for heart disease. So make sure you talk to your doctor about that. Now to the second part of your question, which is what should I look for? While women can have chest pain, their symptoms are usually much more subtle. So here are some red flags to look for. Unusual fatigue. If you're feeling really tired, this isn't just normal tiredness. This is like severe fatigue, right? Very, very tired. Maybe you're having jaw pain or neck pain or even back pain, especially between the shoulders. That could be a sign that there's something going on with the heart. And then nausea or indigestion. Sometimes women will be misdiagnosed with actually having an ulcer or gastritis when the real culprit is actually the heart, which is causing some of these symptoms. So if you have sudden nausea combined with shortness of breath, you need to get that checked out. So in summary, yes, you actually could have a heart attack as young as 30s, 40s, or 50s. And a family history of a heart attack in the 50s is a major risk factor for you. And remember that heart disease is the #1 killer of not only men, but also women. So very important question and very timely. Thank you for joining us for this episode of SAC Health Answers. Again, remember that your primary care doctor is your partner in your personal health and wellness. So any questions you may have, please ask them. And thank you for joining us, and hope you join us for our next episode.